Question from Representative Hood.
Hi there. I'm really thankful for the executive recs around inclusion and reducing health disparities. I was thankful to see some investments in our migrant worker population and also the continued focus on infant mortality and the challenges that women of color have with uterine fibroids. Can you share a bit more about how this proposed initiative will work and some of the anticipated outcomes? In Grand Rapids, our community struggles with a really tough infant mortality issue that we haven't been able to solve despite a lot of federal investments. So I'm curious how this will link with local communities. Thank you.
So those health equity investments, as you mentioned, are comprised of a number of different elements, specifically targeting infant mortality rates. We'd be looking at obviously the availability and access to education about contraception options, because we know that child spacing is incredibly important part of good outcomes for both mom and baby in those families. And then additionally, the Centering Pregnancy Program, which would provide supports and resources to pregnant families to get the support that they need. Those would be the two that I would identify right offhand when it comes to infant mortality. And Farah, I don't know if you have anything that you'd like to add on any of the other programs that we have included.
Yeah, thank you. In addition to that, I would say that we really took a close look at how to improve the health equity in our vulnerable and more marginalized populations from birth to adulthood. And so when we looked at birth, we really saw, in addition, we touched briefly on the need to have doulas. Doulas are trained birth workers who have non-clinical emotional, they provide that physical and informational support to pregnant women and their families. And so we think that that is a really safe and cost-effective way to reduce the risk of complications that would carry through a child's life. So we're looking at that and some of the other, recovery of birth expenses to support our families and not continue to recover those. We see a huge gap between the 34% of births to white mothers covered by Medicaid. The rate jumps to 58 to 72% of births to Hispanic and Black mothers when we're looking at this disproportionate impact of recovering birth expenses. So kind of trying to look at it across the continuum and happy to provide additional detail.